The federal government says it has met 19 out of the 20 demands made by the doctors. Minister of Labour and Employment Dr. Mohammad Maigari Dingyadi made the plea in Abuja during a conciliation meeting with relevant stakeholders. The minister called on NARD to respect the country's laws and suspend its industrial action, reminding it that by labour laws and ILO conventions, when issues are conciliated, all parties are enjoined not to employ arm-twisting methods to mediate or foist a state of helplessness on the other party. In this case, the employers, the Federal Ministry of Health.
Yet, the strike continues. The question in everyone's mind, what exactly is the sole point? And more importantly, what is the actual situation? We're joined this morning to have this conversation by our guest, who is a medical doctor, the president of the National Association of Resident Doctors, Dr. Mohammad Usman. Thank you very much for joining us this morning.
Thank you for having me this morning.
All right. So the federal government claims that 19 out of 20 of your demands have been met. Is this correct?
I mean, if that were correct, we would have been back at work, right?
We don't know. That's why we're asking.
Well, because you had also said to us in previous interviews, because you had said to us in previous interviews that until all your demands are met, you will not return to work.
Yes. You know, it's not nice to call elders, especially when they have made public statements, incorrect. Let me just go straight into the issues. Take, for instance, the promotion areas that we talked about. We agreed that by Friday last week, all the quantum of the amount of money for the promotion areas will be calculated. And this will be forwarded to the Minister of Finance, who has assured us in one of those conciliations that once I have the figure, I'm going to give you a payment plan. We may not be able to pay all of it now. It will take some time, but we'll create a payment plan and get it across the finish line. I mean, we took the federal government at their word on that. Take, for instance, the issue of the entry level of medical doctors that was stepped down from COMMES 3 to COMMES 2. In fact, in my other presentations or discussions, I said that reduces the salary by 120. Recent calculations have shown that it reduces the salary by 150,000 naira. Now, it was agreed that as at Friday, there will be a response. A letter was written to the head of service. There will be a response to clarify that position so that we move forward as one. As at Friday, in fact, as at this morning, that letter to the head of service has not been written. The office of the head of service is not even aware that, despite having a representation in the conciliation, the office of the head of service is not even aware that this issue is up for clarification. The Lokoja issue is still there. We are still dragging back and forth. The professional allowance table has been corrected. It is time for it to be released. As of Thursday last week, we were told it will be released in a few days. We came back on Friday to sign that MOU as agreed during the conciliation, and we were told it will only come after 2 weeks, not at 2 weeks, not before 2 weeks, after 2 weeks. If you look at the issue of salary arrears for our members, in 5 hospitals that have between 3 months to even 20 months, we were told the compilation will be made as at Friday. This will be forwarded to the Minister of Finance. In one of the meetings, he assured us he will create another payment plan for that. It won't come immediately. We agreed, you don't have to pay it immediately, but forward it to the Ministry of Finance. As at this morning, that compilation has not been forwarded to the Ministry of Finance. If you look at other issues like the membership certificate, we agreed on that conciliation table that will take it to another body to have a conversation. As I'm telling you, the conversation in that other body has taken a nosedive. Now, you have I can go on and on and on all the other issues. For instance, the upgrade of our members who have passed Part 1, who are supposed to move from COMMES 3 to COMMES 4, and then 1 year later to COMMES 5. This is over a year. That has not been done because it has been centralized back to Abuja. And I've explained in previous conversation why that happened. We've agreed that the Ministry of Labour will write the Office of the Accountant General, latest by Thursday last week. As I'm talking to you this morning, that letter has not been written to the Office of the Accountant General for the IPPIS office to take action on that. In fact, they're even waiting for the letter to start action. Now, at the end of Friday, after the conciliation, we came to sign an MOU. We sat down, we were very excited. In fact, out of trust, as of Thursday, we put out notice for a National Executive Council meeting to review the signed MOU. We went there on Friday, and we were told goalposts had to be shifted. 2 weeks were being added on multiple issues. Issues that were agreed to be concluded as at Friday were not even attended to. By the time I took this matter with the National Officers Committee to the National Executive Council, we were flogged. We were asked, why are you coming to us without signed memoranda of understanding, without concrete actions being taken on all these issues? So to see that a press release is reflecting that all the 19 demands have been met, please show us the alert of the promotion areas to our members. Show us the alert for the salary areas for our members in those hospitals. Show us the resolution of the membership certificate. Show us the letters that are supposed to reach the head of service and the clarification from the head of service. Show us the letter to the accountant general and the clarification or action taken as a result of those letters. You simply can't come to the media and begin to spew things as if doctors are unreasonable. I mean, we are scientists. We deal based on hard evidence. Show me the hard evidence that this has been done. Lastly, the 25-35% was paid. We sat down in that meeting. We all agreed that 40% of resident doctors have not gotten that arrears. The decision was that a remittance report is going to be generated from all the payments so that we look at what the issues are. Are they failed payments? Are they account detail problems? Are they name problems? Are they omissions? So that we'll find a solution, work around it. And we even volunteered that we can even go and sit down and do this together with the government agents that are supposed to take care of this. As I'm talking to you, that remittance report is not available. Even the accoutrement allowance that more significant of our members have gotten, there are still a large proportion of our members on the Give Me platform, on the non-regular platform, that we are still sorting out. In fact, we are even going to volunteer to help sort out the names. Oh, this one should be here, that one should not be here. That has not been finalized. So why are we coming to the media to tell people that 19 issues have been sorted out?
Dr. Suleiman, thank you for giving us a background to it. And from what you've said, we're very far from seeing an end to this industrial action. Unfortunately, from the breakdown you gave us, is not even anywhere close to 19 of 20.
It is not at all.
But I haven't looked at this checklist and the reality on ground. And I believe you and your members are holding on to this industrial action to correct the anomalies in the medical sector once and for all. What does that say about the people you're having negotiations with? Like you said on Friday, you thought a number of issues would have been solved. And some of these government departments and agencies have representatives in the meetings. You were also ready to sign MOUs just to see the goalposts moved and another 2 weeks added. What does this do to the spirit of your members, and how long are you willing to hold on to your position?
Following the National Executive Council meeting, these issues were x-rayed. Every item on the checklist was looked at, and the National Executive Council directed that the MOU as currently being proposed should not be signed because goalposts have been shifted. Now, for me, I report back to the National Executive Council. If I'm called for a meeting today and that MOU is on the table and necessary corrections and actions have been taken, I will sign that MOU. And I will immediately call for a National Executive Council meeting to review the progress made so far. Now, permit me to put it this way. All these issues, all these 19 issues have been agreed upon years ago. For instance, the professional allowance table, have agreed since 2014 that whenever you review basic salary for doctors, you would review the allowances. Same for other health workers. Since 2019, you have the minimum wage, you have the 25-35% adjustment, you have another minimum wage. 7 years, that adjustment was not done for allowances. What is the implication of that? Every allowance every doctor gets in this country is between 45 to 60% of his actual allowance. Now, government wants to go ahead and review the salary structure in the collective bargaining that has been stalled. Now, you want us to get into that collective bargaining with a negative in our allowances. You don't want to take us to the baseline that we belong to, which is legally agreed upon. You don't want to do that. Now, what is the implication of it? You go to negotiate on a negative number. I mean, is that not cheating? In fact, we even have a 7-year arrears. Shouldn't we, by right, be eligible to get those seven years arrears? No, the conversation is even now on, why don't you release the table? Why don't you implement the table? And then the conversation is taken from there. Now, The table was going to be addressed a few days Thursday. It was now moved to Monday. It was moved to Friday. It was moved to 2 weeks. It was moved to after 2 weeks. As I'm talking to you, nobody knows the status of when that table will be released. This is just one issue. If we take time to x-ray all the other 19 issues, you will hear similar, same, or deeper issues. With regards to whether how long this will last, it is entirely not up to Dr. Mohammad Usman Suleiman. It is entirely up to the National Executive Council. And for those men and women in the hallowed chambers of the National Executive Council of NARD, it is simply a matter of put your pocket where your mouth is. When you promise, try and live up to it. It is the only call I have for the federal government. And let me take this opportunity to call on Mr. President. I know you have a lot on your plate. The insecurity, the international incidences, I know you do. And I really understand. Even at my own level, a small association like ours, we have a lot on our plate. But please, it is time for you to really look critically into these issues. Perhaps this conciliation needs a bigger arbiter. Perhaps there are reasons why some of these issues don't want to be cleared. These are issues we've already agreed upon years back, have been flouted by the same government. We are coming back to re-agree. Even at the point of signing the MOUs, the goalposts are being shifted. What message does that send to the average resident doctor? That you're not valued, that you're not respected, that you're not appreciated for the work that you do, that promises and assurances and agreements made with you will not be honored. I mean, I was flogged on the floor of the National Executive Council. Why are you coming to us without signed agreements and implementable actions? Why are you coming to us to say, can we consider suspending this strike? I mean, it is the only body I report to. I don't report to the federal government.
Well,
right,
it seems, yeah.
I mean, it's sad that we're still back, having this conversation. We'd hope that the next time we hear an update from you, it's to the effect that there has been
I really hope
progress.
So. In fact, out of trust, because these issues, we discussed them. And I saw, to me, on the table, I saw the genuineness, the concern. Even without signing the MOU, I went ahead to summon a National Executive Council meeting through constitutional means, so that we will beat time. We don't have to come and sign the MOU, and then we're now waiting for time for the meeting to come. And then time came for the National Executive Council meeting, and there were no resolutions on the table. Only for me to see on media reports that all 19 demands have been. I was now wondering whether it was another Nigerian Association of Resident Doctors that was discussing with the federal government.
Wow. So I think it's clear to highlight here what we've done here on Breakfast Central is to itemize and highlight the fact that the story that the 19 demands have been met out of 20 is a farce. It's false. It's not true. And that's the clarity that you've brought to the table. Well,
meaning that you're still on strike, right?
Yeah.
Yes.
Yes, we are still on strike.
Okay.
Quite shocking. I mean, like he said he thought it was another NARD, maybe National Association of Resident Divers, perhaps.
Yeah,
but,
not doctors, but then again, I mean, thanks for making it clear. Nigerians are hopeful that the strike will be called off, because I also saw some videos of people crying about not getting adequate and proper treatment at the hospitals because some doctors were not available and so on and so forth. It hurts. It pains.
It really does.
That we have to go through all of this. But we look forward to have you again. And please do accept our call when we reach out to you, especially when you have an update and we also hear of any other update from the federal government.
Thank you very much. Please help me pray for doctors too who have been without salaries for several months. Help me pray for them too. They're also crying, they're also in pain, they're also suffering. And I hope the government will understand. It is not the responsibility of doctors to save lives. It is the responsibility of the government to provide for doctors who save lives.
I mean, we've always shared that sentiment with you here on the show to say that we understand where you're coming from, and we know that the welfare of doctors is important. A doctor that treats a patient needs to be in the right state of mind, and needs to be taken care of so that they don't transfer that, you're distracted, you're sad, you're having issues to deal with. We want our doctors in the best frame of mind, having been properly taken care of. So we do hope that this matter is resolved and that the government pays attention soon. Thank you very much for joining us this morning.
Thank you for having me.
All right.